First of all, good morning, everyone. The Markkula Center for Applied Ethics is excited to have everyone tuning in today and joining us for this Get Vaccinated webinar. During the next half hour, we will be talking with a professor from Santa Clara University's Department of Communications about misinformation and how its impact on marginalized communities during the pandemic. To introduce myself, my name is Amana Liddell, and I will be hosting today's webinar. I am a senior at Santa Clara University, and for the past couple of months, I have been working with the Ethics Center to host these Get Vaccinated webinars. Our guest for today's webinar, Misinformation in Marginalized Communities, is Melissa Brown, an assistant professor of communications at Santa Clara University. Ms. Brown received her undergraduate degree from the University of Georgia and her master's and PhD from the University of Maryland in sociology. As a sociologist and scholar of Black feminist thought, digital sociology, social movements, and sexual politics, we are very excited to have Professor Brown join us today to look at the effects of COVID-19 misinformation, how we can address it, and how it manifests in marginalized communities. To start us off today, we're going to talk a little bit about misinformation in general and the role that it has played during the pandemic. Professor Brown, could you start us off by telling us what is media literacy and why is it important?
Thanks, Mana. Thank you for having me. I'm excited to have this conversation today. So media literacy, if we go off of the definition provided by the National Association of Media Literacy, is the ability to encode and decode symbols transmitted through media, mass communication, usually written, text, and print type messages. And so when I refer to media, I generally mean communication in various formats, whether written, visual, or text. And in my own research, that kind of looks like social media, right? So looking at platforms like Instagram, Twitter, and Reddit. That being said, I would say that media literacy is very important because information and communication technologies are kind of the primary way that we receive information today. And it's also a proxy for social interaction. So I would say that in addition to media literacy, we also need to have social media literacy. So social media is typically defined as social networking applications or social sites where you can engage in network communication on internet-based platforms and exchange various forms of media. So that said, social media literacy would involve decoding and evaluating and creating communication in relation to not only media, but also social interaction on these platforms. And I think that this is important because in this day and age, there's a decline in the ways that people are consuming information in various platforms. So people are consuming less print information, they're consuming less information from television. And in this day and age, social and digital media are kind of the primary ways that we consume information and interpret our social world.
Yeah, and I think that's a really good distinction that we have to make between news media, television media, and social media, because really they are different. And I think one important distinction is a lot of times that television media or print media automatically kind of comes with a little bit more credibility when we're consuming it, where social media, anyone can post XYZ on social media without kind of as much of a vetting process. And so an important question that I think we should talk about is how can we decipher between facts and opinions?
So I think that we have varying definitions of what fact means in particular. So I would say, like, in the academic sense, we typically refer to facts as something derived from the scientific method. So that involves hypothesis testing, theory testing, and then some type of application of methodology, whether it's experimentation, qualitative analysis, or statistical analysis. And then after we arrive at our conclusions through our scientific methods, we get scientific consensus. So typically, say if you were pitching your research to an academic journal, they would put it through peer review and other scientists in your field would evaluate the claims that you make in your research. But the other type of fact is also the facts of life. And so these are the facts that are derived from your sensory experiences and your lived experiences and how you experience the world. So we kind of frame those two types of facts as objective facts versus subjective facts. And so I would say this differs from opinion because generally people don't formulate opinions on the basis of scientific methods. So even if their opinions are informed by facts, they're not the result of scientific methodology. And generally, even when people have a public consensus about what their opinions are, so maybe if you see like a poll in the newspaper about a particular topic, you'll see that 60% of Americans believe this particular ideology or this perspective, that's not necessarily saying that they are arriving at scientific consensus, because their opinions aren't necessarily evaluated in the same way. So ultimately, I would say the difference between facts and opinions are that facts are verifiable, whereas opinions aren't.
And I think that kind of brings up a really good point. For opinions, is a lot of people can believe one thing,
Mhm.
and that doesn't mean that it's true or a fact just because there's a large group of people that believe it. And kind of the science behind things is a really important driver in the pandemic of kind of what are we basing our beliefs and things off of? Is it someone's opinion, or is it fact that's been derived from research,
Exactly.
which is really important. And so the next question that I have for you is, what role has misinformation played in the COVID-19 pandemic, and what impact does that have?
So when we think about misinformation, I think of two things, both misinformation and disinformation, and I think they're interrelated. So misinformation is this idea of information that's inaccurate some way, so therefore it's not fully based on facts. And then disinformation also plays a role in that there's an engineering of deceptive information to manipulate people's perspectives, whether for like political or ideological aims. So currently, the research on the effects of misinformation during the particular pandemic is still ongoing. So I'm going to kind of just theorize about it. And I think there's like three things that I would say are the impacts of misinformation in the pandemic. So first, I would say there is a refusal to follow public health protocols. So misinformation has led people to have hesitancy around vaccines. It's led people to refuse to wear masks in spaces that have mandated mask wearing. And it's also led people to kind of disregard social distancing as proper public health protocols. There's also an erosion of social norms. So I would say that misinformation has driven a lack of trust in scientific experts. I think it has led to the invalidation of fact-based news reportings from major news outlets that we've typically trusted in the past. And then I would also say that there's been, if we reflect on particularly at the beginning of the pandemic and who was the president at the time and who was driving the discourse at the time at an elite level, there is an increased anti-Asian bias and an increased anti-Asian violence that resulted from the misinformation, particularly about the ways that the pandemic began in China. And then lastly, I would say there's a weakened authority, weakened sense of authority from the public to certain governing and regulatory bodies, such as the government and other institutions. And I think that we can think about this on three different levels. If we think about it specifically in the context of political institutions. So for example, at the local level, we're seeing people kind of interrupting school boards and interrupting city councils kind to push back against these governing bodies implementing various vaccine mandates and requirements or social distancing and mask wearing. At the state level, we're seeing things like lawsuits against governors. We're also seeing demonstrations at state houses. And then at the federal level, of course, we can think about the current lawsuit that was filed against the Joe Biden administration, specifically in relation to private businesses having vaccine mandates.
Yeah, and I think this is a kind of very interesting topic in the sense of how all of these different ways that misinformation has impacted the COVID-19 pandemic. If we are losing any piece of these protective measures, whether it be social distancing or masking or vaccinations, all of those things work together to build our protection against COVID-19. And so it's really important that we are protecting ourselves and others in every way that we can, whether that's making sure we are still wearing our masks, making sure that we are still social distancing, or making sure that we are getting vaccinated if we haven't been yet, just to make sure that we are able to trying our best to get the COVID-19 pandemic under control. And we're this far into it.
Yeah.
And there's definitely been moments where we thought we would have been able to get into under control. And I know most of us didn't think we'd still be here today, kind of dealing with this in our daily lives. So it's really important that even now that we have been living through this for this long, that we still are practicing these safety measures like social distancing and masking and getting vaccinated.
Yeah.
And so we talked kind of a little bit about the distinction between social media and news media or print media. Misconceptions about vaccines as a result of hearing misinformation are a big reason that people have been reluctant to get vaccinated, by kind of hearing things that aren't factually true about vaccines, and then taking those as their personal beliefs. and you having that as the reason why they haven't gotten vaccinated.
Right.
Knowing this, how can we encourage this group of people who haven't gotten vaccinated to get vaccinated?
So I think in part, encouraging people to get vaccinated, kind of, we have to think about what people are used to accepting when they make a change, right? So one thing to take into account is that this is probably the first major pandemic on US soil in the 21st century. And so the reason why that matters is because up until the pandemic began, there were only a certain select few of people who had knowledge in the US level anyway, about what to do during the pandemic. So for example, my father is one of those people because he's an epidemiologist. And so he had gone around the world, traveled to different nations, confronting and addressing pandemics and instituting the same exact protocols that we use here. So hand washing and mask wearing, depending on what type of spread or the ways that that particular contagion spread in that particular event. So I think we have to think about, we're asking people for the first time in history to kind of conform to these standards and protocols that in the US historically, we just did not have to do. And I would also say that we have to think about the ways that vaccine misinformation kind of maps onto the ways that misinformation is plaguing other realms of social life as well. So in my own research, I recently released a report with the Brookings Institute about bystander intervention in online racism. And one of the things that we discovered in that report is that misinformation plays a role in the ways that people online discuss people of color, in particular Asian and Black people, and Latinos as well. So in that space, one of the ways that we found that people were able to combat misinformation about people of color was by presenting education and evidence. So if they would see somebody spread misinformation about people of color, they would then link to some type of resource or report, whether from from the CDC or from some type of other entity that kind of has knowledge or expertise on that particular subject. So education and evidence is a really good strategy I would warrant for misinformation in general, even in the context of COVID-19. And so I recently saw a tweet yesterday, I think, where a Black woman medical professor by the name of Uche Blackstock had posted about the fact that regardless of the ways that we think the pandemic is at an end or we're in post-pandemic, in reality, hundreds of thousands of people have died up to this point, and 1,000 people are still dying today. Tens of thousands of people are still getting new COVID-19 misinformation. So one of the responses was somebody saying, oh, well, 20,000 people die every day from hunger and 3,000 people die from climate change. So why is this different, right? So this is a person kind of framing a misinformation, and the misinformation is in that, one, they didn't specify their time period. So, and two, they didn't specify their context. So it could be true that 20,000 people die each day from hunger, but is that a global metric? Is that a local metric? You know, and we have to take into account scale when we're thinking about these things. And that was kind of the ways that people responded to this misinformation, was saying, well, you didn't say where you got this information from. You didn't say what your scale is. You didn't say what your context is. So I'm not going to endorse this information because it doesn't meet the standards of education and evidence. But that being said, that's only one approach, and it's not necessarily the most effective approach for everybody, right? Because different people feel differently about who they're hearing certain types of messages from. And so we have to take into account that people also kind of figure out that, oh, I only want to hear perspectives based on the status of an identity of the person or the messenger who is sending that particular message. So thinking about the way in the context of, say, marginalized communities, a lot of times people want to hear from somebody who looks like them, and that kind of increases their trust. So we have to also think about how people might reject education and evidence if it's not coming from their family members, if it's not coming from their peers, if it's not coming from even their favorite celebrity. So education and evidence, I would say, is the best approach, but also taking into account who the messenger is and how they go about sending that message is really important as well.
I think that's very important because there are different ways that we can kind of control the perception of certain information that is out there, and making sure that it is perceived in a way where it is recepted is really important, especially for like public health agencies and government agencies that are trying to get this information out there for the greater good of the people, whether that's encouraging people to get vaccinated or earlier in the pandemic, making sure that people are following these stay-at-home orders. And I feel like for me, personally, I feel like I have seen at least a little bit more of a conscious effort to include diversity in a lot of these advertisements and public health announcements and different things throughout the pandemic, which has been really nice to kind of see as things have gone on, because as we'll talk about a little bit later in the webinar, COVID-19 has disproportionately impacted marginalized communities in so many different ways. And so kind of this conscious effort is really, really, really important, especially because a lot of these marginalized communities do have distrust when it comes to medical professionals due to things that have happened historically over the course of time. And so another question is, who seems to be the producers of misinformation?
So I actually think that's somewhat of a tough question because I think that immediately when we think of who produces misinformation, we kind of take a top-down approach. So we kind of look at the elite institutions or powerful entities who are kind of responsible for disinformation. But I'll also say that if we kind of backtrack, we all participate in misinformation. And so one of the ways that I think about it is we used to play this game of telephone when we were in kindergarten and pre-K, and that kind of lesson was to teach us about the ways that communication can be warped from person to person, from node to node. So if we take into account using social media and smartphone technology, I would say that we're all quite literally playing a game of telephone every single day. But that being said, when we think about where the misinformation comes from, I think that there's a disinformation to misinformation pipeline, meaning that powerful entities are kind of purposely pumping misinformation out into the virtual sphere and into other media outlets that people consume, and then they struggle to understand misinformation. And once again, this is a thing that happens not just with COVID-19, but with other processes and topics as well. So one sociologist named Christopher Bale wrote a book called Terrified. And in the book, he talked about the ways that civil society organizations were able to mainstream their perspectives and shift culture around anti-Muslim sentiments by exploiting the ways that mass media like television or print and social media like Facebook or Twitter tend to profit and tend to amplify from the most dramatic stories and the types of stories that kind of manipulate our perspectives about our social world. And so I do believe that that's the same type of process that we're seeing going on with COVID-19.
Yeah, and I think especially for kind of those bigger name companies or those more elite things, those people do kind of have a little bit more credibility automatically because they are bigger companies or things like that. And so it's important that people are extra weary no matter where their information is coming from, because people might have other things that they're kind of looking to get out of certain messages that they're sending, whether it's more business, money, or anything like that. And so what should people be aware of or watch out for when they're consuming information about COVID specifically?
So I would say that this is where media literacy and social media literacy comes in, and kind of, cultivating that as a personal practice and then applying it. So first, what you would want to do is evaluate your sources. And I would say that in the context of COVID-19, if we think about this idea of fact being both evidence-based and lived experience, the people who I would say that you would want to kind of pay attention to first are the people who are trained to address epidemics, so public health professionals in the realm of epidemiology and virology and these other types of scientific fields that speak to the realities of COVID-19. I also think talking to medical professionals who are actively treating patients who have COVID-19. And then, of course, people who have survived COVID-19 and had the lived experience of what COVID-19 has done to their bodies and their physicality, and then even the ways that many of them can kind of account for how not listening to certain types of public health protocols played a role in them acquiring the infection. And another thing that I think that we can do in addition to evaluating our sources is I think that we can look to history. So I think the ways that we kind of consume media in the 21st century, and kind of like our fascination, especially with Silicon Valley, with the ways that media technology and internet technology has kind of transformed so much, we tend to forget that there's nothing new under the sun. So that being said, we have to think of the ways like how have historically people in the United States dealt with pandemics. And so what we see is that, say, during the 1918 Spanish flu pandemic, people did wear masks. During the 1940s, when polio exploded at epidemic levels, people did get vaccinated in order to end the wave of polio at the time. So, and not only that, but like when we take polio into account, people survived that particular epidemic. So taking into account, like speaking to our elders about what was it like growing up during the polio epidemic and how did that affect you? What was it like getting the polio vaccine and things to that effect? So I also think bringing that together with like both scientific and experiential learning in the case of history is important. And then, of course, the last thing that I think people should do is ask questions of information. So I think the way that the broadcasting of information and then the way that we consume it, usually through the user interface of some type of device, whether it's a smartphone or a tablet or a computer screen, kind of primes us to be very passive. And instead, what we should be doing is critically evaluating the information that's getting to us and not taking it at face value. So thinking about, did this news story or documentary or research report provide enough context? And what's the scope of the information being provided? So sometimes people might be reporting a story about COVID related specifically to a particular city, but they might be talking about COVID at a global level. So taking into account what is the specific context of what they were referring to, and then thinking about how was the information collected? Was this information collected by some type of journalistic or scientific standard, or are people kind of pulling the Nicki Minaj and saying, well, my cousin told me that their friend said such and such, right? And that brings in like this idea of like telephone again and how communication gets worked in that aspect. And then also thinking about who is giving you this information, like who's the person, who's the organization, what are their perspectives, how do they typically lean when they're providing this information? Because I think we have to kind of admit to ourselves that as much as we value objectivity in our society, especially when we bring in social medias into account, people are not really as objective as they claim to be, and that can warp how they present information too. And so I ultimately think that you should also bring into account, like, what are my personal biases and how am I interpreting this? And am I interpreting this information as it's actually being reported or shared, or do my own personal perspectives kind of skew the way that I'm interpreting this information as well?
I think that's very important. And I think it kind of touches on why misinformation is something that's so powerful, because there are so many things that we do need to consider when we're consuming information. And sometimes it's just easier to read it and
Yes.
believe it to be true and go on with our day. And so I think it's really important that we are making this conscious effort to ensure that the information that we are taking in is credible, and that if we are going to go on to believe it, that we are also doing our own research, checking our sources, and things like that.
Absolutely.
And so with the few minutes that we have left, I want to make sure that we draw our attention specifically to marginalized communities. And so one question that I have for you is, how does misinformation impact or harm marginalized communities specifically?
So historically, marginalized people have had a reason to be mistrustful of all the institutions that are implicated in the COVID-19 pandemic, and that's the medical institutions, the government, and media systems. These institutions historically are responsible for constructing narratives about marginalized people, whether they're marginalized by their gender, race, or sexuality, that have disempowered them. And so in the age of mobile internet technology, particularly platforms like Twitter and Instagram, marginalized people are now empowered to have their own voice. And so what that leads them to do is enter into digital spaces where they kind of amplify their own perspectives. But the caveat of that is a concept called echo chambers, where basically this idea of people constructing virtual, not specifically virtual spaces, but constructing spaces where they're literally just parroting back what they hear and what they like. And that also leads to this idea of confirmation bias. Basically, people have the psychological tendency to seek out information that kind of adheres to their own perspectives. So I think that we have to take into account that marginalized people have a reason reason to be fearful of these institutions and are seeking out information online that can lead them to misinformation. And that misinformation then can ultimately harm them in not seeking out resources that they might need to protect themselves during the pandemic, taking into account how inaccessible these resources are anyway, regardless of whether or not misinformation is driving that disparity.
Thank you. And I think it is so, so, so important. And I've done research on this through the Ethics Center, of acknowledging the historical kind of reasons that people have this mistrust from marginalized communities. Because I think understanding that is a very, very, very important piece of the puzzle for making sure that we are doing a good job of making, when we are targeting information towards marginalized communities, is making sure that we understand where people are coming from and the things that are coming before we are, and
Yeah.
where our information is coming from. And so one question that I also have is, how can we combat these effects of misinformation in marginalized communities?
Um, so I think we talked about it a little bit. And so I think we need to both diversify who our experts are, but also diversify the way that we present expertise. So for example, generally, because of the ways that marginalized people have been affected by these institutions, they're not trusting of the ways that these institutions present information, right? So whether it's journal articles or news broadcasts or other types of ways that elite institutions present information. And further, these people are more willing to turn to their own peer networks, their own family members, and even online strangers in virtual spaces that, they share like-minded perspectives with similar people. So I think being able to kind of shift the ways that we create information and present information, and being aware that marginalized people are the experts of their own forms of communication, right? So we historically, these institutions of media and medicine and health communication are kind of constructed on Western ideals of sharing knowledge, but marginalized groups have their own ideals of sharing knowledge and disseminating knowledge. So being amenable to using those approaches, I think, is one good strategy. But also we have to think about the ways that these institutions aren't diverse enough themselves, and we need to integrate better people in the medical fields, in the media, and in government, particularly at the local state levels, of people who kind of represent these marginalized groups and can have access and communicate the interests of these groups.
Thank you. So with the couple minutes that we have left, I have one final question, which is, what strategies can be implemented to ensure that marginalized communities have equal access to scientific and reliable information? And I think you kind of touched on this with making sure that we're diversifying the people that are in these fields that are kind of portraying this information.
Yeah, I think those are like the two key ideas that I think I would say are kind of the best approaches. Is if we want scientific information to be accessible to marginalized people, we have to allow marginalized people to produce scientific information. And then furthermore, taking into account the ways that marginalized people have their own historical perspectives of communication and communicative practices that are valuable, that are just as valid, and emphasizing those and privileging those. And I think also kind of the way that we structure information is so top down. I think a bottom-up approach would be valuable. So rather than starting from these medical or government institutions disseminating the information, forefronting the people who have been affected by COVID-19, how it's affected them not only like as survivors of the illness, but also as survivors of the economic and social shifts that it's created. And then taking into account the people who have kind of the boots on the ground, the practitioners dealing with people interpersonally and how COVID-19 is affecting them. And then lastly, kind of following up with our institutional kind of approaches to addressing and disseminating information.
Awesome. I think that's a great approach that could definitely be very beneficial if it were better utilized, kind of. And it's definitely hard when it comes to resources and different things like that. But Professor Brown, thank you so much for joining us today and sharing all of your insights with our audience. If you weren't able to tune in for the entire event or want to share this webinar with others, the recording will be available soon on the Markkula Center YouTube channel, along with the recordings of all of our previous webinars. Next week, we will be hosting our last Get Vaccinated webinar. And to close out the series, we will be welcoming professors from SCU's biology department and COVID-19 advisory team to tell us what we should know about keeping ourselves and others safe this holiday season. Until then, I encourage you to visit the Get Vaccinated page on the Ethics Center website. for more information on the work that we're doing as part of this campaign to get people vaccinated. Thank you all for tuning in today, and we look forward to seeing you next time.